The current guidelines for colon cancer screening, meaning you have no symptoms, but you just want to be screened, starts at age 45 for those who have no family history. If you have family history, it's 10 years minus the family history index age. So you want to start earlier. And the key to that is because we know it saves lives. Or regardless of your age, if you have any symptoms, meaning unexplainable weight loss, anemia, rectal bleeding, pain, any of those alarm symptoms, you really should check it out. If we do a colonoscopy, that is one way to see the precancerous growth, polyps. They're benign until they're not. The definition of a polyp is an abnormal growth. But abnormal growth is actually called a tumor. Some turn into cancer in 10 to 20 years. Some turn into cancer in 1 to 3 years. Some turn into cancer typically in 5 to 6 years. So it is important not only to remove the polyp, but have them sent. The pathologist will look at it. They'll tell us what type of polyp and when the next surveillance colonoscopy should be so that we can catch them as they crop up. The smaller they are, the easier it is to remove completely. If it gets so big we can't remove it in one piece, and the risks goes up where we have to remove it in piece style, or we may even have to send them off to the surgical colleagues for a surgical resection. The later you are discovered or diagnosed, the lesser option you have and more invasive intervention you require. All colon cancer could have been prevented, and that's hard to say because you don't want to blame anybody. That being said, theoretically, if they were screened, it could have been caught, and it just breaks your heart if anybody dies of colon cancer, because unlike other cancers, there is a great screening modality. There is a great prevention option available. I always say any form of colon cancer screening is better than no form of colon cancer screening. The gold standard is the colonoscopy because there's nothing more accurate than being actually inside the colon with a $90,000 lens, and we can kind of look, and if there's any abnormal growth, we remove it right then and there and you're done. So that is why it remains the gold standard. But it is considered invasive because a patient has to take a bowel prep and they have to have some anesthesia and they have to be instrumented. And even if it's just a hemorrhoid, it's better to find, why did you have that? Are you not emptying as well as you thought you did? Did you incidentally discover you have diverticular disease? You don't want to ignore those because that's your body telling you something is going on in your body that you can help so that it doesn't get worse. The earlier you're discovered, you can change that trajectory now and change up for the better.